We'll have an interview with him, and the Kentucky Association of Marriage and Family Therapists, Dr. Eli Karam. Now, this is one of our favorite segments because we do it live, baby. This can be a lot of fun. If you have any issues with family members, whether it be your spouse, maybe you have a, what do you call it? A
significant other, a blended family.
Blended family, that's right.
Even a friendship that you're having a hard time dealing with. Marriage and family therapists, they're going to work with anybody in their relational issues.
571-5263, and this guy is very, very good. If you're looking for a therapist and you don't want to go on television, that's okay. Where should they go?
Yeah, you can go to www.therapistlocator.net. And what that does is it is going to give you a list of all the therapists there. You see it right there, that you click that rectangular box and you're going to put in your information. You'll get a list of all the therapists in your area, which list their kind of specialty. And remember, all marriage and family therapists are going to view you in your full systemic context. What does that mean? It's jargon for they're going to, what's going on at home, what's going on at work, what's going on in all your significant relationships. And they're going to see you from a health perspective with strength, not psychopathology or deficit. That doesn't mean, though, if you have a diagnosable disorder, that a marriage and family therapist can't help you. So you look on there, you find their specialty, you call them up. Any marriage and family therapist, licensed marriage and family therapist, that's abbreviated, John, LMFT. Any LMFT is going to be able to give you a couple minutes of their time, and you can kind of assess who they are, what they're like. You can also go to their website, and there's over 400 in Kentucky, most of them centered right here in Wave Country.
Alrighty, we do have a caller now. Thank you so much. Sarah is with us. Sarah, you have the expertise of Dr. Eli Karam. Go ahead, please. Hello, Sarah. Go ahead.
Well, my question is, I have a daughter, and I haven't seen her or spoken to her in 2.5 to 3 years, and we live in the same town, but she won't have anything to do with me or her brothers. For what reason, we don't know, except her husband asked for a divorce at that time, and it did go through, but she also has 2 children that are mildly autistic and very mildly, and another one that's in college now is okay. But I've tried everything I can think of to get her to contact me, and I just don't know what I can do.
So Sarah's question is a good one about what do you do when you have a family member, in this case her daughter, where there is cutoff. And obviously cutoff is very painful even for family members that are having problems, because you're missing a significant part of that loved one's life. So usually there's some significant reasons for cutoff. So you said, Sarah, you speculated a couple things: a divorce, issues she's having, some developmental disabilities, on her children are on the spectrum. So generally when people don't want to have contact, it's because there's a specific reason. They're either really angry or there's a lot of guilt and shame, and they don't want to deal with anyone in their family that knows about that. So you say you've tried everything. What have you tried?
I've sent emails after emails and letters after letters and cards, and I've tried to call, and when I call, she always puts me on voicemail. And now my sons, there's one especially that has texted her a couple of times, and she's responded not very well, but she did respond. But
what she can do, so it sounds like you've reached out, and she's not just doing this to you, she's doing it to multiple members of your family. So she probably has her reasons for cutting off from everybody. So it's very difficult, especially as we head into the holiday season, to have that. So marriage and family therapist can help you work with that kind of ambiguous loss, and that she's here, but she's not really here because she's not has contact with you. And they can also kind of help you put out a plan to kind of cope, or also if you do reach out in the best interest of your daughter and your grandchildren. But MFTs deal with that all. So I'm sorry for your cutoff, but I hope you can get some support that you need. Thank you, Sarah.
Very good call. Sarah's heart hurts, I can tell. Sarah, we feel for you, and the best of luck. You might want to get a hold of a licensed marriage and family therapist, courtesy of Therapist Locator. Let's go to our next call. Mary is with us now. Mary, welcome to the show.
Yes, hi.
Hi, Mary.
Okay, I have a son that is, he's in the military, and he went overseas and he came back a different person, of course, and he's got PTSD. and he doesn't seem like he wants, he knows he has issues, but he don't want to, he thinks everybody else, and he wants to be above her, above everybody,
Yes.
you know what I mean?
Mary, is he still active military?
Yes.
Yes.
And he has a family, of his own, and but he kind of distanced himself from me, I feel. I don't know what he does around everybody else, but, it's different. And I've got a lot of things going on myself. I have, tumor and stuff going on, so I have to deal with that. And when you try to talk to someone that you want to be close to, you've been close to, and then all of a sudden they change on you like that, and I have to, walk on eggshells around him.
Yes, I appreciate that. So it is a good question. It's like, how do you support someone that clearly has had trauma? In this case, his military experience, PTSD, post-traumatic stress disorder. How do you support someone that doesn't really want to get help? Well, first, to kind of understand, the military has lots of good resources, many mental health professionals. However, there is a stigma in the military. That's why I asked if he's still active duty, in the sense that if you admit that you have PTSD, that you are weak or less than, and that's not what you want when you're serving your country. So that is the stigma that even if there are services there, some servicemen and women will not take advantage of them because they feel it will label them. However, it's a very real condition, treated with medication and with cognitive behavioral therapy, and certainly being so close to Fort Knox, marriage and family therapists work with military and their families to kind of understand that, because you said you've reached out to him, but there's a lot of that you can only understand by being in the military. So a marriage and family therapist is going to give you a map of how to unpack the trauma. He's going to work both individually, in this case with your son, but also give you, his family, other loved ones, kind of the information to understand how the treatment's going to work. So there would be a piece in that for just your son, and there would be a piece for the couple as well. And the family.
Thank you very much, Sarah. Mary, thank you for the calls. Once again, Dr. Eli Karam, there's the location on the internet. Check it out if you have any issues with your family, marriage and family therapist here in Kentucky. That's the Kentucky Association of Marriage and Family Therapists. Coming up, Heisman Trophy winner Desmond Howard. Yeah, going to get a little football advice courtesy of the Duck of Aflac. And of course, Michael Vanover. We'll be right back on Wave 3 Listens. We are live.